So I try to only eat grass-fed, grass-finished, or cage-free or organic meats, because you're gonna have a healthier meat with packed full of micronutrients, and it won't have a bunch of omega-6s and pesticides and chemicals in it. Dairy is reasonable as long as you're not eating it all the time. And then aged cheeses actually are really good for K2. So you'll get more vitamin K2 with things like natto, Parmesan and whatnot. And then your fruits. So pigmented fruits like cherries, blueberries, strawberries, they're gonna have antioxidants. And then citrus has a lot of micronutrients in it that are awesome for immune system and brain function. So I try to eat 3 or 4 oranges a day, believe it or not. I never drink orange juice, because orange juice is basically just a shot of sugar. You only eat the whole oranges because you're getting the fiber and everything else with it. Vegetables, obviously, eat your veggies. There's really nothing bad you can say about vegetables. They're mandatory for good health. A true Mediterranean diet, you're gonna have 9 servings of fruits and vegetables, different fruits and vegetables, every single day. Now, unachievable, I get it. That's why I supplement. But theoretically, that's what we should do. Most important, avoid sugary, high sodium, and processed foods. So if you just avoid ultra processed foods and excess sugar, you're gonna at least stop the nerve damage where it is. And then hopefully over time, you'll reverse it with a better diet. Key micronutrients you're looking for in your diet or you supplement with them: the B vitamins necessary for DNA synthesis and tissue repair. And also nerve function is heavily reliant on B vitamins. That's why a lot of people with B12 deficiencies will have neuropathies. Vitamin D, there's D receptors everywhere, especially on immune cells and nerve cells. Alpha lipoic acid is a wonderful antioxidant that treats nerve pain and promotes nerve health. Omega-3 fatty acids, very important for the lipid insulation and also for the cell membranes in your brain and in your peripheral nerve system. Also highly anti-inflammatory. Calcium, not only do you need calcium for your bones, but every synapse to dump out the neurotransmitters have voltage-gated calcium channels. Calcium is the #1 way cells communicate to each other. Very important. Vitamin C, I already told you why. Also, it's a strong antioxidant. Vitamin E, a fat-soluble antioxidant. Alpha lipoic acid is fat and water-soluble. It's got dual action. Vitamin C is water soluble, vitamin E is fat soluble. They're gonna work in different parts of the body. I love ALA for nerves because it'll get into the water dependent tissue portion and the fat dependent. PEA, palmitoyl ethanolamide, you're making some right now, I'm making some right now. We probably just don't make enough. I take this every day, and I definitely tell my diabetics or anybody with neuropathy to take it. I take it for brain health and longevity and to make sure I never have nerve problems. But this actually will treat nerve pain, and it's a first-tier treatment in a lot of countries. It's a fatty acid amide in the same family as the endocannabinoids, okay? So like anandamide and things like that. It reduces inflammation at the very tiny nerve endings at the length dependent and around joint capsules and in muscles. So people with a lot of pain, I put them on PEA, ALA, and then other things, but that seems to really tremendously drop down nerve-based pain. So what foods to avoid? Basically the American diet, okay? Now, once in a while, fine. Your body can handle any toxic dump once in a while and process it. We're built for that. We evolved on a very scary planet, right? So you can handle a bad meal at a restaurant once in a while. You just cannot eat like this anymore all the time. You've got to start making your own food with real foods.